Okay, I think we are good to get started. Hello, everyone. Welcome again. My name is Chacha Miller, and I am a registered dietitian specializing in maternal and pediatric care. And I am also the chief clinical officer for Mother of Fact. Mother of Fact is a telehealth platform for nutrition care from registered dietitians for women from pre-pregnancy fertility issues throughout pregnancy and beyond. We specialize in high-risk nutrition intervention and care and work primarily with birthing people from resource-restricted areas. So if you have any questions or curiosities about Mother of Fact or who we are or what we do, I will drop my email address in the chat so you can feel free to message me following the webinar. Before we get into the webinar itself, let's do a little bit of housekeeping. Please, everyone, keep your microphones on mute and save questions for the end of the presentation. You are also welcome to drop your questions into the chat, and we will make sure to get to as many as we can. That said, welcome to our third webinar. This webinar is number 3 in a free webinar series that we recently launched. So please stay tuned for announcements regarding our December webinar, which is going to cover what to eat in the third trimester to help support birth and postpartum recovery. We do also have the free recordings available for session number 1 and 2, which covered topics like managing nausea and food aversions in the first trimester, as well as eating for energy. So if you are interested in seeing the recordings of those, definitely let me know and I can send the links right over to you. Our topic today, I'm very excited for this one. We are covering gestational diabetes, prevention, management, and what you need to know. And before we jump in, I want to introduce our presenter and one of the dietitians here on our team, Destiny Nolan. Destiny is a registered dietitian. She's based in the Atlanta, Georgia area, where she lives with her husband and her now 9-month-old. Is she 9, 10 months? We're getting close. Destiny began her nutrition counseling journey helping women with hormone imbalance and fertility. When she soon realized this led to patients needing support in pregnancy too. So this is kind of what led her to Mother of Fact just 2 years ago. Destiny loves helping women through their pregnancies with food and nutrition, as well as being another piece of their overall support system. Destiny is absolutely amazing, so I'm very excited for her to present this topic to you. In addition to Destiny, we do have a special guest today. Abby Simmons is an intern here at Mother of Fact. She completed her undergraduate degree in nutrition and food science at the University of Vermont and is currently pursuing her master's in nutrition and health promotion at Simmons University. She also works at Boston Children's Hospital as a diet tech, and she is especially interested in women's and pediatric health. So we are very excited to have her here. With that said, Destiny, I will let you guys go ahead and jump in.
Awesome. Thank you so much for the intro. I'm so excited to be here with you guys, and super excited to be presenting on a very hot topic in our community, but I mean, amongst all of, women's care and maternal health. So we'll go ahead and get started. For a quick overview, we're going to discuss what is gestational diabetes, how does it develop, what causes it, how it's diagnosed. Then we'll go a little bit into risk factors and prevention. And then we're going to get more into the application of nutrition for managing, reducing risk of gestational diabetes, some very practical tips that you can take home with you. And then we're going to wrap it up with a couple of myths and hopefully change your mind about some of those little things. So, with that, what is gestational diabetes? So, gestational diabetes is a form of diabetes that only forms during pregnancy. So, outside of pregnancy, you can have type 1 or type 2 diabetes, but specifically, gestational diabetes is pregnancy only. So, during your pregnancy, your body is not producing enough insulin to kind of maintain healthy blood sugar levels. So, insulin is used kind of, I like to think of it as a key to a door to let sugar into your cells to be used for energy. And for whatever reason, during pregnancy, we're having a little bit of issue with that where the key isn't unlocking the door quite correctly. So, it impacts how your cells are using sugar, and it can have some impact on your pregnancy and your baby if it goes unmanaged and untreated. So it's super important to make sure that we're managing it, screening early, and getting treatment appropriately. So, but what causes all of that? The science is a little squirrely, and there's not any true, like, one reason for gestational diabetes that we know of. There's kind of a few different things that could be impacting that and increasing that risk, but there's no one true definitive thing that leads to gestational diabetes. So, some of that could be from placental hormones. So, when your placenta is forming to take care of your little baby, it produces extra hormones and things like that that can kind of block how your cells are signal or responding to insulin and how your body is releasing that insulin. So, could be related to hormones. It could be related to, and that can lead to a little bit of insulin resistance effect where the key, like I said, is not unlocking the door quite properly on the cells. The insulin isn't working quite as efficiently as we want to on the cells to maintain that blood sugar level. And that's going to lead to a little bit of high blood sugar. And if you have some issues with blood sugar prior to pregnancy, there could be an increased risk there. But it is very important to note that gestational diabetes is not your fault. It is not something that is, like I said, there's not one true thing. It's not, definitive what causes gestational diabetes. There's many risk factors, which we'll go over. So, the screening and diagnosis timeline for gestational diabetes. If you are at a higher risk and you have multiple of those risk factors that we're going to discuss, you may be screened really early in your pregnancy, as early as 12 weeks or so at your earliest appointment. They may do a screening then just to catch if you do have multiple of those high risk factors. Otherwise, typically, in otherwise no concerns pregnancy, you may have a screening around 24 to 28 weeks. This is going to include a glucose test where you are given a certain amount of glucose in a beverage form and you drink that, and then they're going to take your blood sugar. And if it's a little bit too high, you may end up doing a second test, a 3-hour screening. Which is a little bit more extensive, but it's just to be really sure to get a lot or a few more data points on how your body is responding to sugar. So, that's what every normal healthy pregnancy, you're going to have that completed around 28 weeks. And if you are high risk and you had an early screening, you may end up having a second one as well. So some people do have two screenings and you can pass both screenings and not have any complications there. But that's when we're screening. And then if you are diagnosed with gestational diabetes, you are going to work with a team of healthcare providers, your OBGYN, maybe a dietitian, maybe an endocrinologist to kind of help manage your blood sugar levels. And they're just part of that extra support to make sure that we are maintaining healthy blood sugar levels overall throughout the rest of your pregnancy until baby is born. So, common risk factors that do increase your risk for gestational diabetes. Like I mentioned, there's no one true thing, and there's no person that is completely cleared of gestational diabetes. It can develop in any pregnant person. So I wouldn't say that anybody is completely off the radar for gestational diabetes, which is why everyone gets screened during their pregnancy. So with that being said, there are risk factors that do increase your risk. These things don't mean that you're definitely going to have gestational diabetes, but they do increase your risk. So these, if you have multiple of these, is when you might receive that early screening earlier on in pregnancy. So that includes your weight or your BMI. If you are categorized in overweight or obesity early in your pregnancy, they may check your blood sugars a little bit early. Family history, if you have family members that have type 2 diabetes, maybe if your parent or your mom, your grandmother, siblings had gestational diabetes in their pregnancies, that might also include or be another risk factor that would increase your risk. Age and ethnicity. So if you're over the age of 25, and then if you are African American, Hispanic, Asian, or Native American, you do have an increased risk as well. And then if you have certain medical history, such as PCOS or prediabetes, or even if you've had gestational diabetes in a previous pregnancy, all of those things can increase your risk for gestational diabetes. So if you have multiple of those, your doctor, your OBGYN, they're going to be a little bit more cautious and want to do screening a little bit early for you. Now, like I said, you can have multiple of these things and still not be diagnosed with gestational diabetes and still go on to have a completely healthy pregnancy. So, don't be too stressed. Just keep those things in mind. So, for preventing gestational diabetes, there are a lot of things that we can do, but it's like I mentioned, we don't fully understand why people are diagnosed with gestational diabetes and some people aren't. So it's while all of these things can help reduce the risk of gestational diabetes, we can't promise 100% that you will not get that diagnosis. So, like we said, hormonal shifts are going to play a little bit of a part in that. So those are kind of things that we don't have as much control over. We don't have as much control over, your age, your ethnicity, things like that, your family history, but there are things that we can control a little bit. So, some of those things include focusing on balanced meals, which we're going to talk extensively about today, different practical things that you can do when it comes to balancing those meals with healthy carbohydrates, fruits, veggies, lean proteins, healthy fats, and how you can use all of those things to help manage or reduce risk of gestational diabetes. And we'll talk a little bit about the plate method, which is really helpful. Eating regularly, so avoiding skipping meals, not going extensive amounts of time without food. Essentially, that leads to blood sugar crashes or drops. And then when you do finally eat, you may lean a little bit towards a carb heavy meal or snack because your body is smart and knows that's what's going to help you. And that can lead to a blood sugar high and then crash. And then it's kind of like the blood sugar roller coaster, right? So eating regularly is going to be super, super important. And then we're going to talk about what to eat and how that can impact blood sugar as well. Making sure that we're choosing appropriate carbohydrates. Of course, we're not going to say, hey, you can never ever have this particular food or, beverage again. However, we have to be very smart about the balance of the carbohydrates that we're choosing and um, limiting certain carbohydrates and choosing more complex carbohydrates that have a little bit more fiber. Vitamins, minerals, things like that can really impact how your body responds to those carbohydrates when it comes to things like breads and pastas and potatoes and things like that. So we'll get a little more into the details there as well. Being active is super important. We recommend 30 minutes of physical activity or moderate to what it kind of depends, but moderate activity 5 times per week is the recommendation. And then if you do have a little bit heavier of a carb meal, or if you're really struggling with your blood sugar numbers, going for short walks after meals can be super helpful as well. In addition to that, supporting healthy weight. So that is something that we do discuss with our patients is maintaining a healthy weight. I know that's a concern for a lot of our patients as well. At least a lot of them that I've worked with is maintaining a healthy weight. So a lot of our food and nutrition recommendations do align with that to kind of help you manage that weight gain during pregnancy. Prioritizing stress and or prioritizing rest and managing stress is going to be super important as well. Um, just overall, if your body is in a state of a lot of stress, which I mean, honestly, who isn't stressed just in general, but especially in pregnancy, there's a lot of things going on. But trying to rest as much as possible when you can and managing that stress can be super helpful for managing blood sugar and honestly, an overall healthier pregnancy. Avoiding skipping breakfast is huge. I know that that one's very, very hard for a lot of the patients that I've seen. I know a lot of people struggle with breakfast, whether there's time constraints or convenience or just appetite, not really interested in food early in the morning. That's where a dietitian can be super, super, super important to help you specifically find ways to, make those food and nutrition changes that can be helpful. But avoiding skipping breakfast is huge. If we're skipping that first meal of the day, it kind of sends us on that blood sugar roller coaster that we talked a little bit about earlier. And then, of course, follow prenatal supplement guidance. So, when we work specifically with our patients, we make sure that we are giving them specific dosages for specific nutrients that they may be lacking, or nutrients that can be helpful in reducing the risk of gestational diabetes. Some of those include magnesium, vitamin D, omega-3s, and maybe even calcium. So, um, those supplements can be helpful too. However, I do think it's very, very important when it comes to supplement use that you work with your a healthcare provider or your dietitian to make sure that you're getting appropriate dosages there, so that it's effective without being overdone. So just make sure that you work with a provider on that specifically. So with that, I'm going to let Abby go over the next two sections. So Abby, if you want to come off of mute, and then you
Yeah.
can go ahead.
All right. So I will be talking about managing blood sugar with confidence. All right. So the goal is blood sugar stability. So with gestational diabetes, the goal isn't to eliminate specific foods, but more trying to keep your blood glucose in a target range that's often provided by your doctor. This is typically achieved through a combination of diet, exercise, and regular monitoring. So to go into that a little bit more, first we want to think about consistent carbohydrate intake. Your dietitian will recommend a specific amount of carbohydrates to eat with each meal and each snack to help keep your energy and blood sugar stable. Also, regular monitoring is really important. You'll likely test your blood sugar upon waking up, which was a fasted state, and then also 1 to 2 hours after each meal to see how your body responds to different types of food. And then the power of pairing, which we'll get into a little bit later as well when we talk about snacks and meals. But combining carbs with protein and fat is the most effective strategy to help slow down the sugar absorption and prevent post-meal spikes. So a key insight here is that stable blood sugar protects both you and your baby. It reduces the risk of complications and helps you feel more energetic and in control. So, eating patterns for stable energy. So, there's strategic meal timing and composition that we can follow. And these can be the cornerstones of trying to manage your gestational diabetes, specifically through diet. So, one thing that we recommend is frequent small meals, as Destiny touched on earlier. So, eating every 2 to 3 hours. Usually, for most people, this looks like having about 3 meals per day and 2 to 3 snacks in between those meals to maintain steady supply of glucose and prevent large spikes or drops in blood sugar. The power of trio, so including a source of protein, complex carbs, and healthy fats at every meal. This combination provides the best support for blood sugar stability. Smart pairing strategy. So we never want to eat a naked carb. So by that, we kind of mean just eating a carbohydrate on its own. We always want to be pairing it with something like a protein or a healthy fat. So this might look like having an apple with peanut butter instead of just having that apple. And then lastly, as we talked about with breakfast, we don't want to skip meals. Skipping meals can lead to low blood sugar, followed by overeating and kind of leaning into those carbohydrate heavy meals. And that can lead to high blood sugar. So consistency is key for stability with your blood sugar. So movement for gestational diabetes prevention. Physical activity plays a vital role in managing blood sugar levels and can significantly reduce the risk of developing gestational diabetes. So even small amount of movement throughout the day can make a big difference. So general guidelines, as we mentioned before, aim for at least 30 minutes of moderate intense activity most days of the week. This could vary depending on who you are, but it might look like brisk walking, swimming, cycling. But as long as it's approved by your healthcare provider, it should be good. Overcoming barriers. If you face challenges like unsafe neighborhoods, lack of transportation, or limited resources, Creative solutions are key. Focus what you can do and not what you can't do. So this might look like just going on a walk during the day or in the morning instead of getting a gym membership. So just doing what's kind of like most available to you, and movement in limited spaces. So indoor walking, like laps around your home or up and down stairs. Online workouts, there are many free prenatal exercise videos available. Chair exercises, so simple strength and flexibility routines can be done while seating, and active chores. So even things like cleaning and gardening or playing outside with your kids, these are all different types of movement that you might be doing throughout the day without even realizing it. And then next, I'll talk about building a gestational diabetes friendly plate, balancing carbs, proteins, and healthy fats. So, first, complex carbohydrates are key. These are your smart fuel choices. So, carbohydrates are essential for energy, but the type matters immensely with gestational diabetes. Complex carbohydrates are your best friend because they're high in fiber, which slows down the digestion of the carbohydrates and helps to prevent sharp blood sugar spikes. Aim to make about half of your plate non starchy vegetables and about a quarter of your plate high fiber carbohydrates. So what this might look like is whole grains. These are a great example of complex carbohydrates. These are things like quinoa, oats, brown rice, or whole wheat bread and whole wheat pasta. And then starchy veggies and legumes, so something like sweet potatoes, corns, beans, and chickpeas. These are also considered complex carbohydrates. You want to focus on carbohydrates that are high in fiber and have at least 3 to 5 grams of fiber per serving. And you want to work on portion control as well. This is key, where collaborating with your dietitian will help you to portion out the correct portion sizes for you during meals and snacks. You always want to pair carbohydrates with protein and fat to further stabilize your blood sugar response. All right, next we're going to touch on protein, which is kind of your blood sugar stabilizer. So it's really important with gestational diabetes. It's considered possibly the powerhouse for gestational diabetes management, and it slows the absorption of sugar in your bloodstream, helping you to prevent spikes after meals, and it also keeps you feeling more full and satisfied. So, how this might work for you is it slows your digestion of blood sugar when combined with carbohydrates, which helps to also promote satiety and portion control, and it provides essential building blocks for baby's growth. So, a golden rule here is to try to fill about a quarter of your plate with lean protein sources at every meal. Examples of lean protein might look like fish, chicken, and lean cuts of beef. Plant proteins are also great options, so things like beans, lentils, chickpeas, tofu, and edamame. And there's a bunch of other great options you might be interested in, like eggs, Greek yogurt, cottage cheese, and nut butters. If you're dealing with a lot of nausea, trying a protein rich smoothie with Greek yogurt or sipping on bone broth might be great options. And then our last macronutrient is healthy fats. These are key for satiety and health. Fats often can get a bad rep, but they're crucial for gestational diabetes management and within a gestational diabetes diet. They have a minimal impact on blood sugar, but they help to increase satiety and are vital for your baby's brain and eye development. So you want to limit unhealthy fats. These are things like trans fats, and we want to reduce saturated fats as well. These are often found in foods like fried foods and processed snacks. We want to try to embrace more healthy snacks, or sorry, healthy fats. So focusing on mono unsaturated and poly unsaturated fats for their health benefits. So some great examples of fats that we might want to include in our diet include things like whole grains, so brown rice, quinoa, oats, and whole wheat products. Nuts and seeds like almonds, walnuts, chia seeds, and flax seeds. Olive oil and avocado oil are great things to try to cook with, and fatty fish such as salmons and sardines. These are also rich in omega 3s. Easy way to add healthy fats is adding an avocado to toast or salad, to snack on a handful of nuts, to use olive oil based dressings, or sprinkle seeds on yogurt or oatmeal. Now let's talk a little bit about some friendly on the go options. So some nutrient dense, more convenient options if you're really busy. Being short on time and money shouldn't compromise your management of gestational diabetes. And there are many packaged foods that can be highly nutritious and fit into your diet. So I want to review those a little bit because it's just key to kind of know what to look for. So, frozen and canned produce, these can be just as great as fresh produce you can get from the grocery store. So, things like frozen broccoli, spinach, mixed vegetables, canned green beans, and diced tomatoes. They're quick, affordable, and they retain most of the nutrients again as fresh produce. Dairy and cheese snacks, so single serve unsweetened Greek yogurts, cottage cheese, cheese sticks. These are convenient protein options and they provide calcium, which is a really important nutrient during pregnancy. So pantry proteins, things like canned tuna, canned salmon, canned chicken, beans and lentils. These are ready to go protein powerhouses. And often these can companies add more salt to these for preservation. So trying to look for a low sodium option when shopping for these types of items is key here. And then smart grain staples, so doing whole grain crackers and whole wheat tortillas, instant oats unsweetened. These are versatile bases for quick balanced snacks or meals on the go when paired with protein and healthy fats. You always want to check the label and look at added sugar and try to minimize the added sugar in a product and lower sodium options as well as high fiber content. These can all help support blood sugar stability. And then some practical strategies for managing blood sugar. Living with gestational diabetes can be challenging, especially when balancing a busy life, family responsibilities, limited resources. So there's some practical strategies we can think about to help make easier, healthier choices. So if you don't have time for a smoothie, which we often talk about is a great option, you can try pre-boiling hard-boiled eggs and keeping those in the fridge. Pairing a cheese stick with an apple or a handful of berries is a great, quick, on-the-go snack. Grabbing a small container of Greek yogurt, if you tolerate dairy, or unsweetened almond or soy yogurt with some seeds sprinkled in, and then pre-portioned nuts and seeds if no one in your environment has an allergy, or roasted chickpeas are great options. If you're lactose intolerant, unsweetened plant-based yogurts, as I mentioned, like soy, almond, and coconut, these can all be really great alternatives to Greek yogurt. You just always want to make sure you're checking nutrition labels for added sugar, as many of these can contain a lot of added sugar if they're flavored, and looking for options fortified with calcium and vitamin D. And then lastly, cottage cheese or hard cheeses are naturally lower in lactose, so if you can tolerate some lactose, these can be a great protein source for you. And then lastly, if you need nut-free options, as we talked about, nuts are a great protein source, but sometimes we can't have nuts in our environment. So leaning on things like hard-boiled eggs or egg muffins, cheese sticks or cubed cheese, roasted edamame or chickpeas, making sure always check labels that they're not processed in a facility with nuts. Small containers of tuna or salmon, as I mentioned before, so canned tuna, canned salmon, always opting for a low sodium option. And then sliced lean deli meats like turkey and chicken with some whole grain crackers and sunflower seed butter. Always making sure to check for nut-free processing, or celery and apple slices.
Okay, awesome. Thank you so much, Abby. So, I am going to go over some smart snacking for balanced blood sugar. Now, I know we just got a lot of information there, a lot of basis, and then a lot of helpful tips that can be practical for mealtime and snacking. So, all of that obviously super applicable for smart snacking, but we're going to go over some more information here too. So, when it comes to building a healthy snack, and I think that this is super practical because I do see it with my patients where maybe they're not in the routine of snacking or their schedule is a little bit harder for them to have three balanced meals where they're sitting down and having a full meal. That's just not always, you know, like what's the word I'm looking for? That's just not always people aren't always able to do that specifically, especially I've worked with a lot of patients that are teachers or they are nurses or just their work schedule doesn't allow them to have three square meals per day. So anyhow, that's where snacks can come in hand. This can also be super helpful if you have struggled with food aversions or nausea, vomiting, those kinds of situations in pregnancy as well. Snacks are your best friend. So Like we discussed with meals, we're going to balance them with carbs, fat, protein. We're going to do that with our snacks as well. You can kind of think of them as like a miniature meal. And I've even encouraged some patients, if they are struggling with appetite and things like that, they can have meals that are more snack-like, similar to like a snack plate, but we're gonna like bulk it up a little bit. So here's some things that we want to focus on with our snacks. So we're going to pair our carbs and our fat, or we're going to pair our carbs with some protein. So always, like we said, we're not going to have naked carbs. We're going to pair that with something. So healthy fats and protein are your best friends. So some examples, apple slices with peanut butter or almond butter can be super helpful. A handful of nuts or seeds with another type of fruit like peaches or berries, that kind of thing. Avocado on toast, crackers, rice cake, whatever feels appropriate for you. A note that I want to make here is we've mentioned fruit a lot, and I've gotten a lot of questions about fruit and can I have fruit? How much fruit? And the answer is most of the time, yes, you can have fruit. And you should. It's full of fiber, vitamins, nutrients that are super important for you and your baby. So I always encourage fruit, whole pieces of fruit over something like a fruit juice or even like applesauce and things like that. I would opt for a whole, fresh fruit or frozen fruit. So yes, you can have your fruit. We want to pair it with something though. So like we mentioned earlier on in the presentation, rather than grabbing just an apple, let's pair something with that. And then always keep in mind that all of these nutrition recommendations, it's very individualized. So what works for you may not work for somebody else that has gestational diabetes. So there will be a little bit of trial and error early on when you're starting to, check your blood sugars and things like that. You're just going to have to kind of find what works best for you and where that happy spot is, specifically with fruit, because I know that that one's a big struggle for a lot of patients I've worked with. So sorry for my side tangent, but I just felt like that was important to note. So, some other snack options. So, we can also do carbs with protein. So, whole grain crackers with some cheese or cottage cheese, plain Greek yogurt with berries or nuts, things like that. And then boiled eggs with crackers, or I know some people like to make like an egg salad kind of situation on toast. That's also a great option. We can also pair some veggies with our protein and fat because protein or veggies do have a little bit of carbohydrate as well. They're not going to be as high as something like a bread or a pasta or something of that sort, but they do still have some carbohydrates. So you're still going to get some energy from that, and they've got a lot of fiber, which is super important too. So, some examples: baby carrots, bell peppers, celery, etc., with hummus. All of those veggies also with cream cheese is a great option, or avocado, guacamole, that kind of thing can be great. A small salad with grilled chicken on it can be helpful, or a good option. And then, like I said, we want to do some balance, like mini meals is kind of what we're thinking of here. So you can do cottage cheese with sliced tomatoes, or we can do like a bean. I know some people like to do like a bean salad, so that kind of sounds good, but a bean and cheese quesadilla, that is like a go-to in my house because it's super affordable, super quick, super easy. You can even pack it to go if you need to. So that's like always on hand in our house. And then edamame or steamed versions can be super helpful. Keep them in the freezer, throw them in the microwave. It can be great on the side. It can be a snack, it can be a side dish. It can be used in a million ways. So, a pro tip, if you're able to and you have the time and ability, we do recommend preparing things ahead of time and storing them in the fridge, pantry, whatever, so that way they're easy to grab and go. Of course, you can purchase items that are pre-packaged in, portion sizes, which are easy to grab and go, but sometimes those come with a little bit more of a cost. So, working with your dietitian on different ways that we can balance out time versus money spent, can be super helpful as well because we all want to save on both, right? Okay, so handling food cravings. This is also a big one, especially if you're struggling with gestational diabetes and you might feel like, oh my goodness, like I'm gonna have to eliminate all of my favorite foods for months and months to come. That just sounds like awful, you know. Doesn't sound like a great idea, but that's okay. That's why dietitians are important. We help you to, still have some of those great foods that you love. So, Totally normal to have cravings, and they can still fit into a well-balanced diet. Whether you are trying to reduce your risk of gestational diabetes or you've already gotten that diagnosis and you're trying to manage your blood sugars, we can still work on this together. So, a couple of things. So, if we're craving some sweet treats, like ice cream, I know that's a big one. Which honestly, ice cream isn't like the worst sweet treat you can have because there's calcium in there, okay? It is made of milk and there's still some protein and fat in there that can be helpful. So, um, it's okay if you want to do your sweet treats, have your ice cream after your dinner. I always recommend let's have a protein-rich dinner first. Let's not just go straight for dessert before dinner, okay? I know that's the life we all want to live, but let's not do that. Let's make sure we have a well-balanced meal prior to. And then some other things that you can do. You can add some nuts or nut butter on top if you're able to. That can help reduce that, your blood sugar spiking by adding some more protein and fat there. If you're craving more salty, crunchy things like chips and things like that, first of all, if you're craving a lot of salty things, you might need a little bit more electrolytes. So that's when dietitian's important. So talk to your dietitian if you're having a lot of cravings for salty things, or pickles, olives, those kinds of things. Talk to your dietitian. But if you are craving those things, we can measure out single servings. And then again, we always want to pair it with something. So if we're able to pair it with some source of protein, fat, avocado, cheese sticks, nut butter, that kind of thing, that can be super helpful for managing that, blood sugar while also getting your cravings in. If you're craving fast foods, which sometimes you may not necessarily be craving fast food and just may be what's most convenient and available for you on certain days or frequently. Again, talk to your dietitian. But if you want to opt for a burger, we can make sure that we're adding plenty of veggies on there. You can ask for extra if you want to, or even get a side salad as well. But making sure that we're getting those veggies, lettuce, tomatoes, onions, things like that can be super helpful to increase the fiber that can, help manage that blood sugar as well. And then if you're craving lots of refined carbs, things like white breads, white pastas, things like that, I always recommend serving size is kind of key here, but also the serving size of what your protein is. And again, that's going to look different for everybody. So it's really hard to give you a very specific, number of, like how much. So it's always going to be a little bit different, but we want to make sure that we are opting for adding some protein to that, whether it's your beef, your fish, your beans, lentils, etc. Making sure that you're having a good source of protein, but also adding some veggies. So if you're going to have some spaghetti, let's add some mushrooms, let's add some bell peppers, some onions, things like that to kind of boost up the fiber in there as well. Okay, and then the importance of a bedtime snack. This one is so key for a lot of my patients, and a lot of people end up having to do bedtime snack if they already have a gestational diabetes diagnosis and they're struggling with, specifically, I see this if they're struggling with their fasting number first thing in the morning, bedtime snack the night before can be super helpful. So, and the reason for that is because the time between dinner and then breakfast the next morning is a very long time for a lot of people. I would say on the, side of like 12-ish hours. That's just a really long time for your body to go without nutrients if you're struggling with blood sugar management. So anyhow, blood sugar or bedtime snack can be super helpful for managing that blood sugar and preventing from dropping too low overnight. So it's going to prevent or reduce the risk of your fasting numbers being too high in the morning. Again, we want to make sure, well, I guess we mentioned it here, the perfect combo. We want to make sure that we're getting a good amount of protein and fat with this snack so that it can help with that satiety and maintaining your blood sugar overnight. But we want to have a little bit of carbohydrate too. Again, this is going to be different for everybody, what works and what doesn't. So again, super important to work with your dietitian, but it can help you manage those high fasting numbers. And then it can also, or we want to make sure that we're focusing on, a perfect combo of protein, healthy fats, carbohydrates. And then timing is super important. 30 to 60 minutes before bed is usually what we recommend. If you're struggling with a lot of like heartburn and indigestion and things like that, you may want to push it closer to 60 minutes before bed just to make sure that you're giving yourself plenty of time for digestion. And then if you're still struggling with that, work with your dietitian on, different things that we can do. A good example, high protein Greek yogurt with some berries or a slice of wheat toast with almond butter can be super helpful. Okay, so now we're going to talk about a few of the myths around gestational diabetes. So, some of the common myths. I got gestational diabetes because I ate too much sugar. Like we said at the very beginning of this presentation, there's no one single thing that leads to a gestational diabetes diagnosis. It's different for everyone. It's gestational diabetes. There's many factors that play into that. So it could be hormonal, which you have no control over really. It could be related to your health history. It could be related to your family history. It could be related to age and all kinds of other factors. So, it's not because you ate too much sugar. So don't beat yourself up over it. It is not your fault that you have gestational diabetes. And even if you get a diagnosis, you can still continue to go on and have a completely healthy pregnancy for you and your baby. So I know it's hard to manage, but that's why we're here to help support you. Myth number 2, I have to cut out all of my carbohydrates. Absolutely not. That is not what we want you to do. That is almost the opposite of what we want to do. We want to just balance out when and how much we're having carbohydrates and choosing the correct form of carbohydrates that can help your body manage that blood sugar a little bit better. So please do not feel like you have to eliminate all carbohydrates immediately. That's again when a dietitian can be super, super helpful to help you manage, how much and when and how and all of those details. Myth number 3, I had gestational diabetes diagnosis, so now I'm going to have a C-section. This is not true. Most women with well-managed gestational diabetes can have successful vaginal deliveries as well. So having uncontrolled gestational diabetes can increase the risk of C-section and other complications in pregnancy, which is why it's super important to do the early screening, to do your gestational diabetes glucose test, and to make sure that you are seeking care and maintaining those blood sugars quickly and efficiently throughout the rest of your pregnancy to reduce those risks. But it does not automatically mean that you have to have a C-section. Myth number 4, my baby will be born with diabetes. Your baby will not be born with diabetes. Well, I can't promise that. Some babies might be born with diabetes, but uncontrolled diabetes can lead to, some complications for your baby when it comes to their weight or their blood sugar at birth. But these are manageable risks, and they're not super uncommon either. So I don't think that your doctor will be super, stressed about those kinds of things. That's why they, want to work closely with you if you do have gestational diabetes. So that just because you have gestational diabetes doesn't necessarily mean that your baby will have blood sugar complications. They may have a little bit at first, but hopefully all of that works out. So it is very important to remember that you have a lot of power in managing your gestational diabetes and having a healthy pregnancy and a healthy baby. And your dietitian is here to help you with that as well. So, perfect timing. Your healthcare team is your partner. So, like I mentioned, you're probably going to have a lot of additional care if you are just diagnosed with gestational diabetes. Your OBGYN may schedule more frequent appointments. You may have more ultrasounds or growth scans for your baby. You may have to see an endocrinologist. You may be working with us through Mother of Fact dietitians to help you manage your blood sugar and to help with food and nutrition and those kinds of things. So lean on your healthcare providers. We're all here to help you. We all have different angles at which we want to help you and your baby, but we are all very much important to the health of you and your baby. So while your OBGYN is going to help manage your overall health for you and your baby during your pregnancy, your registered dietitian is going to help work from the food and nutrition perspective to help manage blood sugar, which will then also help the health and growth of you and your baby during your pregnancy. You may work with a certified diabetes educator, which will also work with you on managing or understanding your blood sugar numbers. And if you are prescribed medication, then they will be helping you with that as well. So Be an active participant in your care, ask questions, voice your concerns, and communicate openly with your team. Your input is very valuable, and we don't know that you have a concern unless it's voiced. So please let us know. We don't want you to be stressing over something that, we can help you with. So with that, we just want to conclude with reminders that gestational diabetes is manageable. It can feel overwhelming, and it is. Everything about pregnancy can be overwhelming, especially with a diagnosis like gestational diabetes. But it's very, very manageable as long as you've got the right support and the right tools. You're totally capable of navigating gestational diabetes in your pregnancy. Nutrition is your tool. It's great for helping to manage your gestational diabetes, reducing that risk if you do feel like you have multiple of those risk factors in your early in your pregnancy. Nutrition can be super important even prior to a diagnosis. So whether you've received a diagnosis or not, nutrition is super important for both of those categories of people. And just know that you're not alone. Gestational diabetes is very common, and it looks different on everyone, and it comes in women with all different shapes and sizes and backgrounds and histories. So you are not alone. It is not just you, and we are here to help support you. And you can also likely find a support group in your area if you are looking for other moms to connect with for different tips and tricks and just to kind of share because it can be a lot to manage. So with that, here are some different ways that you can contact us if you have questions, concerns, things like that. And now I will turn my screen off if there are any questions.
Thank you so much for that, Destiny and Abby. That was absolutely wonderful. You provided us with a lot of really, really great information. We do have a couple of questions. So the first question comes from Shannon. She says, how would you approach intervention for a patient that has cut out all carbohydrates given the gestational diabetes diagnosis and has lost significant weight during pregnancy?
This is such a good question. If they've lost a significant amount of weight during pregnancy, that's a huge concern in general, obviously. I think that for me, if I had a patient that, this sort of situation, I would just gently explain to them how carbohydrates are super important for energy production and the growth and development of their baby, because at this point, you're not just caring for yourself, you're caring for your baby as well. And they don't get to choose what you eat. So it is very important that we make sure that we are giving them what they need to develop and grow appropriately. Weight is always a tricky one, whether pregnant or not. Weight is always tricky to discuss, and it always feels a little bit heavy. And some people, it can be very hard to discuss. So I think we have to take it more or less the weight route and more this is the function of carbohydrates in your body during pregnancy for your baby, and why it's super important that if we're eliminating full food groups from our diet, we're eliminating those nutrients as well. And that is not ideal. Pregnancy is not the time to be making those decisions. So, um, gently is how I would approach it, but with facts and care.
I love that, Destiny. That's a really great answer. And, that's how I would approach it as times I get patients whose providers have maybe directed them to, cut out all carbohydrates. And they might be fearful of going against that advice, which is totally fair. So you definitely have to take a gentle and informed approach and kind of allow them to make the decision themselves and kind of come to the conclusion themselves. So we do have another question from Miss Barbara. She says, when a woman has gestational diabetes, we focus on healthy eating and carbs as discussed in this presentation. Are there any other dietary recommendations we should make just related to third trimester nutrition?
I like this question. So, I think you can go a couple of different ways with this. So specifically to third trimester, whether people or whether they've received a gestational diabetes diagnosis or not, I would encourage them to mm, start preparing for after or like postpartum as well, because you do have an increased risk of a type 2 diabetes diagnosis if you've had gestational diabetes. So those first couple weeks, months after a baby is born, your body's still doing a lot of things. It's still changing a lot. So gearing up for what food and nutrition recommendations can we make during the third trimester that are going to spill over into postpartum as well? And how can we start preparing for that to kind of set you off on your first or your good foot forward, if you will?
I love that answer. Another thing that I focus on a lot during the third trimester is making sure that patients are getting foods that provide a lot of energy, right? Because they labor for nothing. Your body is about to do some really, really hard work. So you need those energy stores. So I focus on, nutrient dense fats, nutrient dense carbohydrates, and just making sure that patients are kind of getting as much as possible so that their body can rely on those energy stores so that they can tap into it, once labor and delivery begins. So I know we are very over time, but I do have another question that I think is really important. So currently, a lot of people are experiencing challenges with SNAP, with WIC. So what are some affordable and accessible protein or healthy fat staples that you would recommend?
Yes, this is a really, really great question. And I think that this is applicable even if we weren't struggling with the SNAP situation today. It's still very, very important because this is applicable for a lot of, a lot of the population we work with as well. So, um, Abby had kind of mentioned canned proteins, canned chickens, canned salmon, canned tuna. Those things can be great for pregnancy, and having those protein options can be super helpful. Um, I think that we just have to be creative with those. And that's where a dietitian can be super helpful. And how can we use these that isn't, boring or bland, things like that. So we can definitely prioritize using those proteins. We just have to be creative using, salmon on salads or doing like a salmon salad kind of situation. Have to purchase these items doesn't mean that your food shouldn't be good. So that's kind of like a side note. But those can be super helpful. Canned beans, legumes, even dried cans, dried beans that you can cook, whether you have a crock pot or over the stove top, things like that. They are such a good source of so many nutrients and fiber and super helpful for blood sugar. So having those things on hand is super, super important. And you can add them to any kind of dish, whether it's breakfast, lunch, or dinner. Even making like a bean dip, like I mentioned earlier, for a snack can be super helpful and still make sure that you're getting a good amount of nutrients in that. Another thing that I've seen more recently are pasta options that have either protein, they are labeled protein, but really they just have a chickpea blend in them or something like that, or even opting for a full chickpea or lentil pasta is super helpful too, because those foods are going to have more fiber, a little bit more protein, and be a little bit more blood sugar friendly. And a lot of times, stores that have just dried pasta are going to have one or two of those options as well. So, that's kind of like our protein section. Our healthy fats, making sure that we're having nut butters, trail mixes, things like that can be super helpful, as well as, like we mentioned, with different like olive oils and things like that. Using those, to cook our foods in can be super helpful too, because a little bit goes a long way. And then I also want to mention, our canned fruits and veggies, our frozen fruits and veggies, super, super great to have on hand in there. And I think the best part of all of these things is they're not going to rot in your fridge. So you don't have to worry about, oh my goodness, like I didn't cook this tonight. Now I'm going to have to toss it out. And now we're experiencing food waste when we're already struggling with affordability of foods. So I think that all of these are great to have on hand in general, but especially if you are struggling with, just the finance piece of these things. So, those canned frozen fruits and veggies can be super helpful. And a lot of times they're a lot quicker to prepare as well. And like I mentioned, a lot of this might sound like bland and boring, but I do think that that's where a dietitian can come in helping you with the creativity of these meals and how to put them together in a way that makes sense, but also tastes good. Because, like I said, it's really important that you enjoy your food as well.
Yes, I totally agree. And I second everything you just mentioned. And these are actually all foods that, as a busy working mom, I keep in my pantry and in my fridge and rely on very regularly. Canned and frozen foods get a bad rap, but often they are as nutritious and sometimes, even more nutritious than fresh. So, we definitely have to encourage that as a good option just in general, but especially for someone who is experiencing challenges with accessibility or resources or things like that. Um, well, that is those are all the questions that we have for today. I could probably think of like a million more, but since we are so much over time, I just want to end things here. But thank you all so much for attending. Destiny, Abby, this was absolutely wonderful. And I will be sharing more information regarding the upcoming webinars soon. So I hope everyone has a great day. Thank you, everyone. Bye.